3D allows us to see the vessel arrangement. The density may correlate to histology. And finally, I want to show you some examples of contrast to depict perfusion. We can also, with 3D technique, determine vessel density and morphology because, as I said, tumors have microaneurysms, stenosis, and blind-ending pouches. And we can look at vessel branching patterns. Now, these parameters have been quantitated using the vascularization index, the flow index, which takes into account the amplitude, and a combination of the vascular flow index. Here is a very vascular tumor, as you can see here. This is another very vascular tumor with some internal vessels, and this cine loop also shows a relatively hypovascular cystadenoma. With 3D sonography, we can identify these branching patterns and determine the relative vascular density. There's been one study which has shown that this data helps reduce the false positive rate in diagnosing malignancies. Finally, I want to just briefly mention the use of contrast. With tumors, one really needs to look at the capillary blood flow. Tumors have areas of increased interstitial pressure due to necrosis. This is a beautiful scanning electron micrograph of the difference between the vascularity of normal with an artery going to an arteriole, going to a capillary, going to a venule, versus on the opposite side, a very tangled vessel with very abnormal branching patterns. So what the microbubbles do is that they course in the circulation. They're about a third the size of a red blood cell, and they allow us to see vessels as small as capillaries. We use pulse inversion techniques, and here's an example of a lesion that is about 2 centimeters with a slightly thickened area. The contrast is injected intravenously, and the image that is built up is shown here. This is the microvascular, which is the persistence image. And one could see that there was no increased vascularity in the wall of this morphologically suspect benign lesion. And we can quantitate the blood flow that we see with contrast using the following parameters. We can look at the time to peak, the peak intensity, and the washout phase, and basically the area under the curve. And when we do that, we can see that this benign lesion has a very quick uptake, a relatively small peak, and a quick washout phase. Contrast that, this is the 3D of this paraovarian cyst with some vessels, and contrast that with this cancer that I'll show you now. This is a benign lesion. This is a solid lesion that was suspect for cancer, but as you can see here with the contrast, we see very little, if any, blood flow in the center of this lesion. This was a fibroma. We'll see that the ovarian cancers, in fact, have significant enhancement. But this lesion, although it was suspect for cancer, had very little or no vascularity. And here's the time activity curve. You see a very quick uptake and a very quick washout phase. Now watch the contrast in this ovarian cancer. This is a 2 centimeter ovary with a 1 centimeter cystic area. Watch the microbubbles as they come in and fill. There's a very large enhancement. And we can see from the time activity curve a very high peak intensity and a very long washout phase. This is in the other ovary. And again, watch the marked enhancement of this lesion. This was also an ovarian cancer. And you can also see from this time activity curve that there's a very long washout phase. Now when we compare benign from malignant, we can see that there's no change in the wash-in phase, but on the maximum enhancement or the peak, there's a significant difference. On the washout phase, there's also a very significant difference. And finally, the area under the curve is significantly different. So what I've tried to do in this talk is give an overview of the use of various sonographic techniques in evaluating patients with pelvic masses, emphasizing the use of transabdominal to look at the global depiction, transvaginal to get the details, color Doppler to look at the vascularity, and 3D to look at morphology and volumetric changes, and finally the potential use of contrast for evaluating tumor enhancement and response. Thank you.